Hi, my name is Nathan Beal and I am 13 years old.
My name is Austin and I'm 20.
Hello, I am Catherine Walker. I am 14 and I suffer from major depression and I am currently recovering from an attempted suicide. Three.
What I personally define depression as is when someone's going through a really hard time of their life and they're having like a really hard time coping with it, so it makes them feel all down because they don't know how to like deal with the situation. So yeah, that's what it is.
Depression is a mental state where you are emotionally lower or more down than everybody else.
I define depression as I call it a mental disorder instead of a mental disease because it's not really curable and it's just something you have to live with, and it's the worst kind of thing. And I guess how I would define it is, okay, I'm gonna say an analogy is, it's like you're drowning, but you can see everyone else around you swimming.
One of my personal like encounters with depression is like my sister was really depressed for a pretty long time, and she was always down, and it kind of upset me that like she wouldn't ever want to go do anything with me, like didn't want to ever play board games. But then she went and saw a counselor and they like bonded, and then at first I wasn't really like happy with her going to a counselor. I didn't think it was right, but then I realized over time that was the right thing to do. And after she went and saw a counselor, we started getting really close and like getting closer and closer. And so it kind of like helped me in a way to get closer to my sister.
Depression, personally, you rob yourself of the joy of life, basically. You take away anything positive and anything, you just don't allow yourself to be happy almost. You just don't, it's like you don't want it. You just stay in that emotional low. And I would say, from my experiences with people who are depressed around you, it's really hard because they almost take the life out of the room, being so down, and it's hard to deal with. And all you can really do for people who are depressed is just be there, because there's nothing you can do to change their mind state. That's a choice they have to make.
My personal struggle with depression and how it impacts me is when I was 10 and up until recently. I've stopped after I got out of the mental asylum. Is I have had a lot of struggle with self-injury, and I have this to prove it, and it's very depressing because it just covers my entire body. And it's the worst because there's not a day that goes by where you don't think about it.
Okay, so I would say people who are struggling through depression, if they were to ask me what I thought they should do, I would say if it's just the being down and the constant, being so sad and low, I would say find people, find friends, find people who aren't always down, who can bring you up, because a lot of people who are down will tend to find someone socially on the same level as them, so they'll surround themselves with more down people, and that doesn't help you. That just keeps you stagnant. You need to be around people who bring you up, not keep you at the same level. And outside of that, that's basically, I think the key to it is just helping yourself be around better influences, I guess.
I would probably tell them to go talk to a friend or a family member and try to get help from them and see what they can do. But if they can't really do anything, I would tell them to go see a counselor, because if you get the right counselor that you can cope with and like become really good friends with, you can get really good advice from them. And then like it could really help you through your situation that you're going through.
The best thing I can tell them is open up to people, because there is nothing that can help you more than people around you. It is compassion and trust.
Alright. Hi, I'm Roxy Sprick. I'm a licensed marriage and family therapist, and I'm going to talk a little bit about depression. The definition of depression that kind of comes to mind for me is that it's a mood disorder that affects our whole body. It affects how we feel, how we think, and how we behave, and it impacts our daily functioning. Oftentimes people experience really low mood, sadness that doesn't go away, emptiness, feelings of hopelessness, and like overwhelming fatigue, really low motivation, hard to get out of bed or take a shower, just daily things that are pretty normal on a normal basis feel really hard. And then not being interested in hobbies and social things that you normally would be interested in is another really big indicator of being depressed. And then along with it can have suicidal thoughts or suicidal ideation or kind of self-harm thoughts. And depression can be caused for multiple different reasons, but oftentimes genetics. It can be passed down through families, hereditary, and then also it can be through circumstances or past traumas, things that have occurred that just feel overwhelming and create a depressed cycle. And some of the things that can be helpful in counseling with clients that I work with, I often encourage counseling, but alongside medication management if needed. That combination oftentimes can be really helpful. And the biggest thing for counseling is just providing support, providing a place to be real and to be heard, and to kind of process really hard feelings and experiences that you're having. And also to gain skills and ways to kind of combat and cope with some of those overwhelming symptoms. And specifically cognitive behavioral therapy is used, and that's the idea that the way we think impacts the way we feel, which impacts what we do. And so a lot of it can be changing our negative thought patterns about ourselves, about the world, and which can feel overwhelming when you're depressed. It feels often like like a cloudy day, and it just isn't going away. Nothing is getting better, and you can't snap out of it. And so it can be really important to seek counseling and possibly medication management. So yeah, I think it's important if you know somebody or if you're experiencing these things that to seek support and encourage others to seek support, because there are ways to feel better.